All right, here we are with Chapter 31. I've divided it into two parts. It's over infectious and communicable diseases. And as a provider, we certainly expose ourselves to many infectious diseases and some communicable as we care for our patients. Being able to identify what the disease is or what the infection is would require us to know all the different signs and symptoms of all the different types of diseases and infections. So oftentimes when we're dealing with an infectious disease, our pre-hospital treatment is just supportive. Supporting the ABCs and treating what symptoms we do see. From a local or federal response, when there's a local infection or an outbreak, we have our community health agencies that do surveillance looking for particular pockets of infectious diseases, and they report that up to the state and the state up to the feds. With widespread infections and outbreaks, in the State Department of Public Health, we have epidemiologists who are physicians who spend their career tracking diseases and infections within populations and trying to keep people safe. So our region has an epidemiologist who works closely with the state hygienic lab and local hospitals and clinics who report certain types of positive tests, like for influenza, measles, chickenpox, those sort of things. I can't stress enough the importance of personal protection when dealing with infectious diseases. Again, we don't know what they are. We don't know what period of the disease they're in, whether or not it's contagious. Some spread very easily with droplet infections, and if we don't take droplet precautions and wear a mask or put a mask on the patient, we certainly could breathe in enough of the disease in the back of the ambulance taking the patient to the hospital to become sick ourselves. Again, with the agencies involved in prevention and management of infectious diseases include our public health agencies within each of your counties, the State Department of Public Health, as well as private sector. When we think about the private sector, that would include employers who offer employees immunizations and those sort of things to keep them safe. And then at the federal level, we have the Health and Human Services Division. Every employer has to have an exposure control plan, and an exposure control plan has multiple components. One of the components is addresses health maintenance of staff, getting regular flu shots and getting the hepatitis B vaccine or whatever the type of infectious disease is, making sure that there's a health maintenance of the employees. Employee surveillance requires employers to report certain types of illnesses, particularly if they have high absentee rates because of a particular type of illness or infection, then that's important to know. Every business is to have, along with their exposure control plan, a designated officer to manage and oversee the exposure control plan. Within this exposure control plan, they monitor response to communicable diseases. Within the plan, they identify which job classifications have to have what sort of immunizations and vaccinations, and they also address bloodborne pathogens. Exposure plans for health agencies also include information about what to do if you've had a significant exposure to blood or body fluid, and then post-exposure counseling. Health agencies work and notify local health authorities, state and federal agencies, if they encounter certain diseases, so that that information is captured and we can receive proper guidance from the State Department of Public Health on how to manage the spread of that particular disease. The exposure control plan also identifies how the personnel, the vehicles, and the buildings are disinfected, and has hazmat education in there as well, talking about how to disinfect following an exposure or following a patient who has bled on something, how that we clean that up and disinfect that. After action reports are something that the agencies or what the healthcare facilities do following an event. They look at what they did well, what they could do to improve their outcomes, and enact those changes into their existing response plan. The hazardous materials education addresses needle disposal, and most of us have at least an annual program that we have to go through that addresses bloodborne pathogens and proper needle disposal, as well as the correct handling of bodily fluid or tinged linens or supplies. Your responsibility as a paramedic is certainly to develop a infection control attitude. Be very particular about your own personal hygiene, attention to your own skin and wounds, and make sure that if you have a wound on your skin, that it's covered so that it decreases the risk of blood or body fluids getting in there. Vigilance on effective hand washing before and after touching your patients, and then making sure of disposing of contaminated materials properly. Now, there are different stages of an infectious disease, and we'll talk first about the incubation period. That is from exposure to somebody who has the disease until the first appearance of symptoms in you. So if somebody is infectious, from the time you're exposed to them until you develop symptoms is called the incubation period. And that usually is anywhere from 10 days to 2 or 3 weeks. The window period is when you develop antigens, but no antibodies are available to fight the antigen. The communicable period is when the disease can be transmitted to the host, or when the person you're caring for is infectious. The latent period is the opposite of the communicable period. This is a period where the disease cannot be transmitted to the host, where the person who is infected is not able to transmit that disease to another person. The disease period is from the first appearance of the disease until the resolution or death of the disease. Now, there are different types of infectious agents. Bacterias are infectious agents, and they are self-producing without a host cell. So in other words, a bacteria will multiply and grow, and it does not need the host's cell in order to do that. Viruses, on the other hand, must invade a host cell and able to reproduce. If a virus can't invade the cell, then it dies and it's unable to replicate. Fungi have a protective capsule around them, which once they get into somebody, it's very difficult to cure them of these fungal infections because of their protective capsule. Protozoa are single-celled organisms that can move about in the body and move about in the bloodstream and cause infections in varying different places of the body. Helminths are not microorganisms. They're not that small. They're actually larger. So helminths would be things like ringworm, hookworm, those sort of things. Prions are infectious proteins that can cause disease as well. And your body has a variety of defense mechanisms in order to stop the disease or the antigen from getting into your body. Some of the anatomical barriers include your skin, the turbinates in your nose, nasal hairs, mucus, all those things, the turbinates and the nasal hairs and the mucus working together to filter the air before it gets down into your lungs. You've got bacterial flora in your GI tract, which is very important in nurturing a healthy GI tract, and then stomach acids, which destroy many of the infectious diseases if you ingest them in food that you eat. You also have an inflammatory response that occurs once you're exposed to a particular disease. And the inflammatory response could be physical in the sense of where you see hives, that sort of thing. Could be thermal, where you generate a fever, chemical, where there's a chemical reaction within the body that occurs, and then invasions by the microorganism. The inflammatory response includes the release of histamine and kinin and bradykinin and some of those other type of substances which will lead to sepsis and some other things that we'll talk about. Now, as far as your immune system and how your body defends against this invading infectious disease, you have humoral immunity, and that's where your B lymphocytes produce daughter cells, and then the daughter cells produce plasma cells, and then the plasma cells go on to produce antibodies, and the antibodies are there to help fight off the antigen should it come back into your system. And then you have cell-mediated immunity, where T lymphocytes coordinate the activity of other immune system components in order to fight off the infection. And then you have the reticuloendothelial system, and these are fighter cells in the spleen, the lymph nodes, the liver and the bone marrow, and lungs and intestines, and they work along with the lymphatic system to rid the body of cellular debris that is created from fighting the infection. Now, our approach to a patient with a possible infectious disease is really no different than any other patient, besides the questioning might be more extensive because their complaints may be extremely vague. So you have to have a really detailed approach of how you're going to do your assessment on somebody with an infectious disease. In somebody certainly that has a rash or a fever or cough or those sort of things, you should always suspect an infectious disease and make sure that you're wearing the proper personal protective equipment when dealing with them. You're going to get a focused history and physical exam just like you would on any patient, but some of your questioning might include the history of their present illness, like what were you doing when it came on, do you have a fever, are you taking anything for the fever, do you have any neck pain or rigidity, which we call nuchal rigidity, and we see that in like meningitis. Rashes, do they have any petechiae or purpura, which we see in sepsis. Any difficulty swallowing or secretions that they can't clear, and then any change in signs and symptoms over time. A good past medical history is appropriate as well. Is this something that they've had before, sort of a chronic type of infection that they get off and on, or a couple times a year, or frequently? Are they taking any steroid or antibiotics to help fight this infection? Have they had a recent organ transplant? Do they have diabetes or any other endocrine disorder like lupus? Do they have chronic obstructive pulmonary disease or any respiratory complications like asthma or bronchiolitis? Get a good detailed history to include their skin temperature and whether or not it's hydrated, and the color of the skin. Assess the whites of the eyes for icterus or jaundice. Check the reaction to the neck when flexing it. So have the patient take their chin and touch their chest, and if doing that causes great pain, then the meningitis might be the type of infection that you're dealing with. Listen to breath sounds, check the abdomen for tenderness, and look at the extremities or the fingers, particularly for lesions or rashes. Now we're going to look at specific types of infectious diseases. We're going to start first with the human immunodeficiency virus. It's transmitted through fluids between two humans. There are two strands of the HIV virus, HIV-1 and HIV-2, and the diagnosis is made by documenting a decrease of CD4 T helper cells. 40,000 people are infected annually with HIV. There is no cure. Many of those diagnosed go on to die. It is believed to have been spread by vaginal and anal intercourse, in IV drug users when they share needles, and perhaps in blood transfusions prior to 1992. The thing with HIV, like many of these infectious diseases, is that the patient may not know that they have the disease. They may carry the virus without ever seroconverting and developing the disease. Magic Johnson, as an example, has the HIV virus but has never developed the disease, AIDS. So transmission can occur without the host's knowledge. They may complain of just feeling sick and not very much energy. Their lymph nodes may be swollen. They may have diarrhea, weight loss, night sweats. Physical signs includes Kaposi sarcoma. And once diagnosed, certainly the person with HIV may become despondent or depressed because there is no cure, and you must follow standard precautions at all times to make certain that you don't get exposed to their blood or body fluids. Here is an example of the Kaposi sarcoma, the dark purple patch on the roof of the mouth there. It's a type of cancer that people with normal immune systems have no trouble combating, but a person with HIV may develop this type of cancer not only in their mouth but on their hands and forearms. Hepatitis A, there's a variety of hepatitis, hepatitis A, B, C, D, E, F, and G, I believe. And hepatitis A is spread by oral fecal route. So person to person is how it's spread. A person who has hepatitis and doesn't wash their hands after defecating may transmit the virus on their hands to the food that they're preparing for you, because that's how many people get hepatitis A, is at a restaurant. Or in somebody who's changing the diapers of a baby who has hepatitis A and doesn't wash their hands either. Hepatitis A can be found in contaminated water, can be found in food. It's usually associated with areas of poor sanitation and overcrowding. It gets into the body by ingesting it. It then spreads to the liver, has about a 30-day incubation period. Symptoms are the patient becomes jaundiced, they have an abrupt onset of fever, weakness, they don't feel like eating, their stomach hurts, they have nausea, their urine is darker, and liver failure is rare when this is treated, and patients usually recover from hepatitis A. Prevention is to, practice good hand hygiene, properly dispose of human waste, and there is a vaccine for hepatitis A that is available. Now here is the distended abdomen from somebody with a severe case of hepatitis. Whether it's hepatitis A, B, C, or D, typically in the liver fails, in addition to being jaundice, this person has what's called ascites. And ascites is just an abdomen that's full of water and liquid, and that has to be tapped, obviously, because it affects their ability to breathe and everything else when their belly's full of that liquid. Hepatitis B, you're 30 times more likely to get hepatitis B than you are HIV. Hepatitis B is a very viral virus. It will live outside the body up to 7 days in dried blood. And hepatitis B has many of the same symptoms as hepatitis A, and you can't distinguish the two without a laboratory test. It is transmitted through blood and other body fluids, and the patient's age is the largest factor in the development of chronic hepatitis infection. Children are most likely to develop chronic hepatitis B infection. Infants, I should say, 90%, and then children at about 25%, and adults about 10%. There is no specific treatment because there is no cure. There is a vaccination that is available that a person can take prior to being in a situation where hepatitis B is an issue. It's a set of 3 shots, and you probably all have gotten them. Prevention is meticulous hygiene, vigorous hand washing, good sharps handling techniques, because hepatitis B most often is transmitted by a deep puncture into your body with a needle that's been in a patient that has hepatitis B. Hepatitis C is a bloodborne virus as well. It's most commonly transmitted by needles or through blood transfusions. It can be transmitted by taking care of patients or in IV drug abusers. Hepatitis C is the #1 cause of alcoholic liver disease. The incubation period is 7 to 9 weeks. Again, prevention is just like prevention in any hepatitis virus, with meticulous hygiene, vigorous hand washing, good sharps handling techniques, and there now is a vaccine available to cure hepatitis C once a person has it. Hepatitis C is the #1 reason for liver transplants in the United States, the #1 reason for liver failure. And there is a vaccine, but because it is so new, it is extremely expensive. I believe a single dose of the vaccine is $120,000. Signs and symptoms include jaundice in color, sick to their stomach, fever, their urine gets dark, their stool gets dark. Many people with hepatitis C can be asymptomatic and not have any symptoms at all, which again, they wouldn't know they're carrying the virus until they develop the illness, and therefore that's another reason why standard precautions and proper hand washing with all patients is important. Hepatitis D, E, and G. Hepatitis D is the Delta virus. It's not a complete virus. It does infect the cell, but it has to do it in conjunction with hepatitis A, B, or C. So it can't do it by itself. It needs either A, B, and C to be with it in order to infect the patient. Hepatitis E spreads like HIV. Hepatitis E spreads like hepatitis A, fecal oral. Hepatitis G is a newly identified virus, and with all hepatitises, what we can do is certainly identify that it could be a potential because of the patient's complaints, their jaundice skin, and we can be supportive if they're dehydrated, hydrate them, position of comfort, those sort of things. Tuberculosis is a lung disorder that's caused by the Mycobacterium tuberculosis. It is person-to-person transmission through aerosolized nuclei. So in other words, a cough or a sneeze or talking for a long period of time with the person with active tuberculosis puts that TB out in the air, especially if they cough or sneeze, and you could breathe that in if you're not wearing the proper protective equipment. It is active when it is airborne, but once it hits the ground, it becomes inactive. High-risk populations where we see tuberculosis is in nursing homes, in healthcare facilities, in prisons, in the medically underserved low-income communities, alcoholics, IV drug users, homelessness, all are at greater risk of developing tuberculosis. The signs and symptoms start gradually and get worse. Fever at night with night sweats, again, not feeling good, feeling weak, tired. They may have unexplained weight loss. They may have a cough, which then later becomes productive and may cough up blood. They have chest pain when they take a breath. They're short of breath, and if severe enough, they can go into respiratory failure, respiratory arrest, and death. On physical exam, you're going to have crackles or rales in the lungs, and a hollow amphoric cavity sound like a empty kettle drum when you tap on the chest. Some things that may mimic tuberculosis that might fool you is asthma, pneumonia, pleural effusions, meningitis, septic shock, and respiratory distress syndrome. So again, it may be difficult for us to pick this particular disease out unless we get a really thorough history and identify these signs and symptoms as being tuberculosis. Treatment is a variety of medications, none that we give in the pre-hospital environment. So our treatment would be supportive, oxygen, suction, position of comfort, and transport them to a hospital where they can be cared for. With practicing droplet precautions. Have the patient wear a mask, and if not, certainly you wear an N95 mask. So here's a picture of a chest x-ray where tuberculosis is present, and you can see in that top right part of that lung, there's quite a bit of infiltrate, as well as over on the right-hand side as we're looking at it, which would be the patient's left. There's quite a bit of consolidation there, quite a bit of consolidation through here, some in here. Okay. Once a person is diagnosed with tuberculosis, then they have to have a chest x-ray every year to see if it's spread and to determine whether or not they are able to transmit that disease to other people. Meningitis is an inflammatory disease of the central nervous system. It can be a virus, it can be a bacteria, it can be a fungus, and it's typically located in an adjacent leptomeninge, which we're talking about between the pia and the arachnoid membranes. Aseptic meningitis is viral. It is self-limited, and usually there is a complete recovery, where bacterial meningitis is more severe. It's potentially life-threatening. It's spread as a result of direct, prolonged exposure to an infected person. It can be spread during intubation, during CPR. A metastatic infection associated with pneumonia. It can be spread from a ear infection or endocarditis. Now, meningitis presents with fever, a stiff neck, unable to touch their chin to their chest, a petechial rash, little red bumps all over the body, altered level of consciousness, diffuse neurologic deficits, so all across the body, some sort of numbness, tingling, weakness, vomiting, increased intracranial pressure, they're not hungry, they have unexplained irritability, they're sleepy, they may have bulging fontanelles in younger children, and then seizures. Meningitis may present like a subarachnoid hemorrhage, or like an encephalitis, or delirium tremens. It's very difficult to tell them all apart. Treatment for meningitis is going to include antibiotics because it's bacterial, supportive, and make sure that they don't become dehydrated. Prevention, there is an inoculation from a purified polysaccharide vaccine that has minimal and infrequent side effects. So it's particularly, we see meningitis in college campuses, and if we know that children are going off to college, in high schools now they're being offered the meningitis vaccination before cohabitating with all those other kids. Meningitis can come on quickly and can be severely life-threatening. There used to be a TV ad about what a 14-year-old girl looks like 1 hour before she dies from meningitis, and it shows her playing on the playground, laughing and having fun with other children, and within the hour she's dead from meningitis. So it is a very particularly bacterial meningitis, a very serious infectious disease. You want to make sure you're wearing respiratory protection and standard precautions. Here they're showing you the meningitis, and meningitis is an inflammation of the meninges. The meninges is that flap that they're pulling back over the brain. That's more likely the dura mater. And below it is the arachnoid, which you see in red, and then the pia, which fits tightly to the brain itself. And the pia mater, as well as the dura mater, you can see is all red and inflamed, and that's the meningitis. Pneumonia is an inflammatory respiratory infection. It affects the alveoli and the surrounding tissue. Occurs more in the winter months than other times of the year. It's very deadly in the elderly. In Iowa, we lose about 1,200 people to pneumonia every year. It can be caused by a bacteria, can be caused by a fungi, can be caused by a viral organism as well. It attacks the respiratory system and the central nervous system. There are different types of organisms that cause pneumonia. There's Streptococcus pneumoniae, there's Staphylococcus aureus, there's Mycoplasma pneumoniae, Haemophilus influenza, and Legionella SPP. So depending on which one of these organisms causes the pneumonia, often determines how the patient is treated, what sort of antibiotics they're given, that sort of thing. Pneumonia can be community or hospital acquired. With a hospital acquired pneumonia, these patients have a higher mortality, and it has most to do with the person's in the hospital because they're sick, and then while sick they catch pneumonia and have poorer outcomes than if the pneumonia is caught in the community. Transmission is by droplet, so sneezing, coughing can spread the viral pneumonia, and direct contact with the host through contaminated linens is another way that the pneumonia can spread. High-risk groups are those with sickle cell disease, those with cardiac disease, those with diabetes mellitus, those with chronic renal failure, those with already some sort of immune suppressed disease like HIV, those with organ transplantation, and those with lymphoma. Symptoms of pneumonia include chills, fever, chest discomfort with breathing, difficulty breathing, and some physical findings that you're going to see in pneumonia are respiratory distress. Your patient's going to be working hard to breathe, maybe even grunting, have an elevated temperature, have a fast heart rate, fast breathing. SATs may be low, and you may hear crackles or wheezing in the lungs. If a pneumonia patient presents with fever, tachypnea, and tachycardia, those three findings by themselves, when present, indicate a condition called SIRS, Systemic Inflammatory Response Syndrome. And so a pneumonia patient whose fever is tachycardic and tachypneic is pre-septic. And if the pneumonia isn't addressed and cared for, the patient can develop sepsis. There are atypical pneumonia presentations as well. They don't present like regular pneumonia. The onset is gradual. They don't have a productive cough. If they have a fever at all, it's very low grade. They may be absent of chills or headache or nausea and vomiting. They may just complain of a sore throat and have symptoms outside the lungs or outside the pulmonary system. So here's a couple x-rays, and here's one with pneumonia consolidating here in the right lobe. And then when you look at this patient, this is all whited out here. This is all pneumonia. This should be black in here, but it isn't. So there's pneumonia there as well. Tetanus. Tetanus is a bacterial spore called Clostridium tetani. It's commonly found in the soil and in the GI tract of animals. It's introduced to the body through disruption of the skin. So if you were digging in soil and you had open wounds on your skin and got some soil all over those open wounds and it had tetanus in it, you certainly could get tetanus. Being bitten by an animal who has tetanus may cause you to get tetanus as well. It interferes with the neurons that inhibit muscular contraction. So as a result, in the late stages of tetanus, a patient develops tetany of the jaw and neck. Tetany is just lockjaw. Their jaw is locked. They're unable to open their mouth. They're unable to move their head. With children, they'll have abdominal rigidity, and with adults, they'll have facial contortions. Tetanus signs and symptoms include muscular tetany of the jaw, neck, and muscles, abdominal rigidity, facial contortions, as we already mentioned. If untreated, tetanus will lead to respiratory failure from the muscle paralysis. Treatment is to give a tetanus immune globulin or tetanus antitoxin. And we all get tetanus boosters about every 5 or 10 years, depending upon our exposure to sharp objects or cuts. Rabies is a viral infection in mammals caused by Rabdovirus. It is transmitted by infected saliva into the bite wound. So if you've been bitten by a rabid animal, the virus multiplies in the muscles and then travels to the central nervous system. Viral replication in the brain is followed by migration to the eyes, the heart, the skin, and the mouth. The cycle is complete when the virus replicates in the salivary glands, then shed into the saliva. So foaming at the mouth is the complete cycle of the rabies vaccine. Phases are the prodrome phase, the excitatory phase, and the paralytic phase. During the prodrome phase of rabies, a person will have fever, malaise, headache, anorexia, not wanting to eat, nausea and vomiting, sore throat, poorly defined sensory changes, poorly defined changes in their vision or their hearing or their sight, runny nose, they may be anxious or agitated, they may be throwing up, they may have some pins and needles sort of prickly feeling or paresthesias, their skin may itch, which is what pruritus is, and then pain at the site of the bite as well. The excitatory phase, the symptoms can be absent, but they begin gradually and persist until death. A progressive anxiety, a progressive agitation, a progressive apprehension, feeling of impending doom, disorientation, neck muscle spasms, twitching, seizures, and the fear of water, hydrophobia. The paralytic phase, general flaccid paralysis, stupor, coma, urinary incontinence, and then peripheral vascular collapse and death. The thing about rabies is that once you get rabies, there is no cure, and it just progresses to death. If you suspect that you've been bitten by a rabid animal, or even if you wake up in the night in the same room where a bat has been flying around, then they recommend that you go get the rabies vaccine because it may prevent you from getting rabies. Bats will get rid of their rabies virus in their urine as well. They don't have to bite you. They can spray it in their urine as they fly around your room. So bats are a big issue when it comes to rabies. Not so much concerned about a bat that gets in your room at night or a bat that you see in your home at night. It's the bat that you see in broad daylight flying around that certainly would be problematic or suspicious for rabies. Again, once you get it, there's no cure, and you just progress to death. Clinical rabies is almost always fatal. So in other words, once we clinically see rabies in you as an individual, it's almost always fatal. Prevention is to avoid exposure to infected animals, clean the wound, and get an immunization or get those series of shots after you've been bitten. And there's a picture of a rabid dog biting on a stick in the very last not biting, they're just holding his head up in the very last stages of rabies. Hantaviruses, they consist of your hemorrhagic fevers. They may cause renal syndromes or pulmonary syndromes. And if it's the hantavirus that's causing renal syndromes, it's called Hantavirus renal syndrome, and if it's pulmonary, it's Hantavirus pulmonary syndrome. Hantavirus comes from the droppings of mice. So you might see it early summer, late fall. It enters the body through the respiratory mucosa. If you're cleaning up, mice turds, those sort of things, and it's dusty and you breathe any of those spores in, you can get the Hantavirus from that. Symptoms include fever, hemorrhage, renal failure, headache, abdominal pain, and lumbar pain. A lot of urine protein in the urine indicating kidney failure. Initially, they may be febrile, which develops into hypertension and oliguria and diuresis. With the febrile stage of Hantavirus, the vision is blurred, double vision, light hurts the eyes, retroorbital pain behind the eyes, face, neck, and back become flushed, pharyngeal conjunctive stain, petechiae in the conjunctiva, axilla, and its pressure points. So you'll get these little red bumps in the conjunctiva, in the axilla, and its pressure points. During the hypotensive phase of Hantavirus, see a rise in the hematocrit level, capillaries begin to leak, and then you have a massive protein spilling from your kidneys, and oliguria is present, and that's not making any urine. With the oliguric phase of Hantavirus, you have severe hemorrhagic phenomenon. That's where the majority of deaths occur in the oliguric phase. You have the fever with GI symptoms followed by a brief lack of producing urine. Treatment is ribavirin if administered in the first 7 days, and then supportive care. After that, it carries a high mortality rate. Viral diseases of childhood include Varicella Zoster, which is chickenpox. It's a skin system infectious disease. It's a vesicular rash having about 250 to 500 lesions. It is in the same family as the herpes, so it is a herpes virus. It is airborne, is how it is spread. The virus is latent in the dorsal root ganglia, and it can reactivate later in life as herpes zoster or shingles. So once you have chickenpox, the virus lays dormant in your nerve roots, and at some point in life can reactivate, causing shingles. Chickenpox are spread by contact with mucosa of the upper respiratory tract or conjunctiva, or contact with ruptured vesicles, the little blisters on their body. When they rupture, that fluid is highly infectious. Lesions are often more numerous on the trunk. They begin as small red spots. They become blisters on an erythematous base, and they form for up to 5 days, and it takes about 3 weeks for them to heal. Treatment is antiviral drugs, which help shorten the duration, acetaminophen for the fever. They avoid aspirin because of Reye's syndrome, and then standard precautions to protect yourself with droplet precautions, mask, gloves, gown, that sort of thing. And there is a vaccination that you can get that decreases your chance of getting the virus. So here is chickenpox in an older person, and it often is much more harder on an older person to get chickenpox because the fevers are usually intensely high, and there's greater risk of getting these on the face or in the eye or something like that. All right, so that ends our first part of this lecture, and we'll continue with the second part shortly, so I'll be talking to you soon.